Thing is, we as Americans, we eat at McDonald's 6 times a week, and then we rely on pharmaceuticals to clean up the mess afterwards.
Right.
Whereas if we just learned how to eat clean, how to move better, how to get plenty of sleep, how to manage our stress, how to manage our posture and our nervous system correctly, a lot of those problems are going to go away. But that's going to require some work on everybody's part.
This week, I interviewed Dr. Kevin Smith. Dr. Smith is a functional medicine practitioner and founder of the Chronic Conditions Center in Pittsburgh, Pennsylvania. He specializes in helping people understand and fix the root cause of chronic health conditions, such as gut issues, autoimmunity, chronic pain, thyroid dysfunction, adrenal fatigue, and inflammation using natural, non-invasive methods. We discuss proper sleep hygiene, along with testing for thyroid issues, how Dr. Smith solves individual health issues, and his one tip to get your body back to what it once was. Really enjoyed my interview with Dr. Kevin Smith. I know you will too. Thanks so much for listening and enjoy the show. All right, welcome to the Get Lean, Eat Clean podcast. My name is Brian Gryn, and I have Dr. Kevin Smith on. Welcome to the show.
Thank you for having me. It's a pleasure to be here today.
Yeah, thanks for coming on. Functional medicine practitioner in Pittsburgh. And you've been doing this for longer than most people, I'd say, in this space. 2001, correct?
That's correct. Yes, sir. I've been helping people to feel better and to move better through functional medicine and through physical medicine modalities.
And when you started doing functional medicine, I'm assuming there weren't too many people in this field at that time.
No, that's correct. So it was kind of in its infancy. I remember back in the early 2000s when I had a patient and I told them they want to reduce the level of inflammation, and taking fish oils. It was one way to increase the amount of omega-3s that they're getting in their body. And a week later, he came back and said that he talked it over with his primary care physician, and he told him that that's just a bunch of quack stuff and don't listen to him and that kind of stuff. So, and they have since changed their ways, and they are completely behind the whole fish oil movement about reducing inflammation and making people feel better. But of course, they try to take credit for inventing it. So,
Yeah. And what has changed since you started till now? I mean, that's 24 years of probably research and new ways of, overcoming health challenges. What have changed in your practice?
well, the attitudes on the part of the public has changed. I think that a lot of people are sick and tired of just having to rely on pharmaceuticals
Sure.
as their only choice. And now people are more waking up to the fact that you can correct a healthcare problem by focusing on lifestyle modification, taking supplements, eating very clean, and things like that, and less reliance on medications these days.
Yeah, I would agree. I mean, I think with just the advent of like podcasts alone and just all the information that's out there, I think people are taking their health into their own hands and finding out what, works for them. I mean, obviously you want to have a physician, but it also helps to have someone that like yourself or myself, who's maybe a little bit attuned to more of a natural way of going about things before you just jump into drugs.
I think you hit the nail right on the head with the whole podcast thing. It helps to educate more people, make people more aware of things that are out there. And as people get more educated and they become more aware of this, they're going to make smarter decisions and rely less on drugs and medications. I'm not anti-drug. I'm not anti-physician. I think that there's a time and a place for everything. But I think we as a people are over-medicated.
Yeah. And what would you say are probably some of the biggest medications that you're seeing most clients are on that they probably maybe could either wean themselves off of, or they're just over prescribed on?
Well, one of them is statin medications for lowering cholesterol. Another one is proton pump inhibitors for decreasing stomach acid. And a third one would be things like like gabapentin, which is mostly it was actually formulated to treat epilepsy, but a lot of doctors are giving it to people to calm down nerve pain, or
Mm.
either because of peripheral neuropathy or some kind of a spinal cord issue. But none of those drugs actually cures you. It actually just masks the symptoms.
Mm. And people that are coming into your practice, are you working with individuals, with like I noticed on your website, low thyroid? Is this something that you run into quite a bit with individuals?
Well, low thyroid disease or hypothyroidism is a niche of mine. That's where I have a lot of deep domain expertise of helping. But people come to see me for problems with falling asleep or staying asleep, problems with gut problems, either constipation or diarrhea or both, poor absorption,
Mm.
brain-based problems such as irritability, nervousness, depression, anxiety, problems with blood sugar issues, either insulin resistance or some form of diabetes, autoimmunity, uh, food sensitivities, chemical sensitivities, unresolved self-infections such as an Epstein-Barr virus problem or a cytomegalovirus problem, or maybe something like herpes. All of those things can disrupt thyroid physiology and cause things like low energy or problems with fertility with women.
Mm.
If they want to make a family, start a family, and they can't conceive, that can be very frustrating for a lot of people. Problems with you eat something on Monday and on Thursday you develop a nagging migraine and you can't figure out what could be the cause of this because so much time has lapsed. They think it has to be an immediate effect. And so we do some clinical testing to figure out what the root cause of that problem could be.
Yeah, and that was sort of leading to my next question. What kind of testing do you do? I mean, obviously every individual is different, but what are other some baselines that you work off of?
So the two broad categories of areas that I want to test for. Number one is autoimmunity. And autoimmunity means that the defense system of the body, the immune system, which is your white blood cells, they go around your body in the circulation and they help protect you against things like a bacterial infection, a viral infection, a parasite, things like that. But something happens, and so that system that's supposed to be protecting you attacks your own body and
Hmm.
attacks and destroys the tissues, such as brain, thyroid, gut, skin, joint. It could be anywhere. And the other category is what I call triggers. And triggers are things that, other than autoimmunity, that could be disrupting normal everyday function, such as blood sugar problems, chronic inflammation, oxidative stress, anemia, things like that. And the way that we identify those triggers in the autoimmunity is by testing. And that testing comes in the form of blood, urine, stool, and saliva. And by doing those types of measurements, those objective measurements, we can get a real understanding about what's going on inside the body and where the person is and where they need to be.
Mm. And I've done some certifications through functional diagnostic nutrition. Is this something you're familiar with, or where did
Yeah,
you sort of?
FDN is a good program.
Yeah.
What they do is very, very similar to what I do. Um, the FDNs that do this stuff, they can order tests and they can try to piece together what's going on. A lot of times it can be very complicated. People reserve the right to have more than one problem, right? So when that happens, how do you know what is causing the problem, what's driving the problem? So, for example, if they have insulin resistance and they have inflammation and they have liver toxicity and they have something wrong with their gut and they have also problems with sex hormones, either testosterone being too low or an imbalance with estrogen and progesterone, we have to figure out where the problem's coming from, what to look at first, And that really is a big part of this, is to prioritize these tests and figure out which one do you do first.
Yeah, it's a little bit like solving a puzzle, right?
It's exactly. So I kind of liken myself to it like a detective trying to figure out where is what's going on and what happened with the crime and kind of piece it back together again. A lot of that is going to be determined based on what kind of symptoms is presenting. And then I start off by gathering, like doing a survey, a medical survey, asking them about their metabolic health and about their neurological health. And based on how they score, that's where I know where to start looking. It's
Mm.
not a diagnostic, it's just an indication of this is what's going on and this is that person's number one issue that they want to get rid of right now. And so that kind of drives the priorities, is based on what can I do to help the person to feel better and to function better.
Mm. And would you say that, I don't know, 80, 90% of these are lifestyle based, things they can change, or potentially even using some type of supplements as well?
That's absolutely true.
Yeah.
Absolutely. The thing is, we as Americans, we eat at McDonald's 6 times a week, and then we rely on pharmaceuticals to clean up the mess afterwards.
Right.
Whereas if we just learned how to eat clean, how to move better, how to get plenty of sleep, how to manage our stress, how to manage our posture and our nervous system correctly, a lot of those problems are going to go away. But that's going to require some work on everybody's part. And we live in a drug culture, unfortunately. And so that's the attitudes of people, is just give me a pill that's going to get rid of this symptom and let me be on my way. And I think that we need to pay more attention to lifestyle modification.
And what would you say, what are some of the biggest tools or things that you leverage in your practice to help, because like you mentioned sleep. I mean, I'd imagine for most people, if we can wrap our arms around quality sleep, it'll probably help lead to a lot of positive health outcomes. Are there certain sort of tools that you use to help individuals with that?
There's a certain type of sleep hygiene that I coach people to follow. Um, there are basic fundamentals that promote good health, and sleeping is absolutely one of them. So you need to have around 6 to 9 hours of restful, replenishing sleep in order to help the brain, in order to help the immune system and reduce inflammation and get things going again. If you're having a problem falling asleep or staying asleep, that is a trigger of an underlying problem. That's an unresolved problem. Either maybe it could be a insulin resistance thing where the body's blood sugar physiology is not stabilized and it's causing disruption, or it's a problem where you have too much stress. Too much stress causes an issue with the hormone cortisol, which regulates your autonomic nervous system, or your fight or flight problem, your fight or flight symptoms. And so when the tiger is chasing you through the jungle, you want that to kick in and you want to pump more blood to your arms and legs so you can run away from the danger or be able to fight the danger. However, once that danger goes away, everything should come back down to normal again. And if it doesn't come back to normal, it ends up causing belly fat production and it causes brain fog. And so that's one of the root issues that we want to handle, is making sure that your cortisol issues, your insulin issues, ghrelin, leptin, inflammation, all that stuff is kind of settled down so that you can get plenty of sleep, so that you can be a productive, happy person the next day.
Hey everyone, quick interruption here. If you are looking to gain energy, lose inches around your waist, and build strength, well, look no further than my book, The Stepladder System: 6 Steps to Lifelong Health and Vitality. What you get with the book is my full step-by-step plan and blueprint that I've worked with all my clients with, packed into one book. With part one, you're going to lay the foundation, tackle any common challenges that might come in your way. Part two is my 6-pillar blueprint how to set yourself up with a solid plan and know exactly what to do when life throws any curveballs. And lastly, step 3 are learning to implementation, a plan for getting results over the next weeks and beyond. So there you have it. I'll leave a link in the show notes for my Stepladder System book. Now back to the podcast. And you mentioned sleep hygiene. What would you say? What are your, like say top 3 sleep hygiene things that individuals could do?
Well, turn off all electronic equipment at least by 7 o'clock at p.m. If let's say the person's going to go to bed at 10 o'clock, you want to be able to shut off all cell phones, tablets, computers a couple of hours before then. Make sure that you don't drink any caffeine, like coffee or sodas or anything, hours and hours in advance of that. A lot of people have opined that you want to be very careful or very mindful of how many carbohydrates that you consume right before bed, because if that causes a spike in your insulin, that's going to also throw off cortisol. Make sure that you are doing other types of things, like maybe drinking a cup of chamomile tea, maybe reading a book. Make sure that the room is very dimly lit and there's no extraneous noises or other types of things that can be disruptive. Make sure that maybe you take a nice warm bath about an hour before going to bed. All these things collectively can add up to helping you to get a better night's sleep. But that's kind of not what people do. They tend to play on their cell phone. They want to surf Facebook or TikTok late at night, and they drink too much coffee or soda or something with too much caffeine, and complement that with some sugary snacks or some chips. And then they wonder why they're having so many sleep difficulties.
Yeah.
But my method is just to take you back to the fundamentals and practice those fundamentals about practicing good sleep hygiene with good nutrition, plenty of plenty of water. You want to make sure you're well hydrated, but not to the point where you have to get up to go take a bathroom break in the middle of the night 3 times.
Yeah, I was going to say, I like to make a general rule of not to eat 2 to 3 hours before sleep, whether it's carbs or not, because carbs have been shown they can actually lower cortisol to some degree. But in general, I just think, eating and then even just going for a walk after you're done eating can help manage blood sugar and help with digestion and help you get a better night's sleep.
Well, one of the cornerstones of the wellness program that I was advocating is getting plenty of exercise.
Sure.
And taking a walk helps to regulate your hormones, helps you to regulate your mood, keep everything in a perspective. Um, Maybe going out and walking the dog, maybe going outside and playing or going to the gym or doing something. A light workout once a day will keep those things in better check. But that in conjunction with ideal nutrition, ideal hydration, uh, stress management, all those things collectively add up.
And regarding, thyroid problems, what kind of tests do you do for that, and how do you go about managing if someone has some thyroid issues?
That's a great question. So when a person that has a thyroid issue, or they suspect that they have a thyroid issue, if they go to their PCP or an endocrinologist, the standard operating procedure is to do the very, very basic minimum number of tests that they can get away with in order to arrive at a diagnosis, in order to prescribe a drug. In other words, they're going to do exactly whatever the insurance company dictates that they will pay for and nothing else. So typically with the order a TSH test, that stands for thyroid stimulating hormone. That's a chemical that's produced by the pituitary gland in your brain that acts upon the thyroid gland to produce thyroid hormone. That's about as far as they're going to go. They're going to maybe order a free T3 or a free T4, and that's about it. And then they're going to give you Synthroid or levothyroxine or some other kind of a thyroid replacement hormone and send you on your way. When I order tests for thyroid, I'll order 10 tests at
Mm.
a time because I'm interested in looking at the entire metabolic landscape and seeing what's going on. So I'll order the before mentioned TSH test, a total T4, a free T4, a total T3, a free T3, reverse T3, T3 uptake, TPO enzyme, thyroglobulin enzyme, and TSI index. All of those things play a role in what's going on. So you got to find out, are you having a problem manufacturing thyroid? Are you having problems transporting thyroid hormone throughout your body? Or are you having a problem with the receptor site on the cell wall? All of the 70 trillion or so cells that we have in our body has on it a receptor site for thyroid hormone. And so thyroid hormone, that's T3, the function of that is it acts kind of like as an accelerator pedal that happens in a car. If you step on the accelerator pedal, the car is going to speed up. If you take your foot off the gas, it's going to slow down or it's going to come to a screeching halt.
Hmm.
The same thing happens with your cells. So if, for example, you're dealing with neurons in the brain, those have a receptor site on the cell wall for thyroid hormone. If they're not getting enough thyroid hormone for whatever reason, they're going to slow down. And so symptomatically, they're going to have things like depression, anxiety, nervousness, irritability, brain fog, cognition problems, learning problems, all kinds of things. And it can also be traced back to thyroid function.
Hmm.
Um, so we have to determine what is the root cause of that. Is it because their bodies are not manufacturing enough thyroid hormone? Or are they having a problem converting T4 into T3 in the liver or in the gut? Or are they having a problem transporting the thyroid hormone throughout the body? 98% of the time, 98% of the thyroid hormone in your body is transported by a carrier protein. And if it's not doing its job, you could have all the thyroid hormone in the world and it can't get to your cells properly. Or you could have problems like chronic inflammation, where it produces cytokines that block the receptor site on the cell wall. If any of those things happen, you're going to have symptoms associated with low thyroid problems. Now, here's the kicker. When you have low thyroid issues and you go to see your doctor and he gives you a drug like levothyroxine or Synthroid, 17% of the time, those drugs are going to be effective. The other 83% of the time, they're not going to be effective. So that means 83% of everybody given those drugs, all 30 million of them, are not going to be helped by those medications.
Mm.
That's a serious problem.
So what steps would you give that individual perhaps to, either avoid or, maybe like wean off those drugs in order to help their thyroid?
So first of all, I would gather some medical information and find out a little bit more about their background, what other medications that they're taking, and for what purpose, what dose. I'll gather all the medical information that I need. After that, then I start them off on some questionnaires, the metabolic questionnaire, the neurotransmitter questionnaire, just to get again a fundamental baseline. And then after that, I would probably send them out for some foundational lab tests in the form of blood and urine. And when those come back, then we sit down, we score them, and we look at them together. And I color code these test results, either green, yellow, or red. Green means they're in the right area, they're in the sweet zone, so there's no problem. Yellow means that they're actually moving in the wrong direction with that lab marker, and red means that they're in full-blown pathology. So we want to look at that and find out where are they at and where do they need to be to correct this problem. From there, then I would likely order a corrective care plan based on what showed up on the lab. Now, everybody is a little bit different. They could have abnormal cholesterols, they could have abnormal iron cycles, they could have that abnormal levels of vitamin D or abnormal levels of inflammatory markers, whatever. And so the treatment plan that I order is custom designed for that individual. There's no two alike. It's not a cookie cutter approach like you get when you go see an endocrinologist and everybody and their mother gets Synthroid. It's completely tailor specific to their particular needs.
Hmm. And I noticed, did you come out? Are you coming out with a book or your second book? Is that right?
Yes, it's being edited at this moment, and I anticipate it's supposed to come out at the end of 2025.
What's the name of it?
It's metabolic solutions.
Very cool. And you're located in Pennsylvania. Do you do like virtual consults and stuff?
Yeah, I do virtual health consulting with people. We're just a phone call away from each other or a Zoom call.
Sure.
So you don't necessarily have to be in Pittsburgh to work with me. Uh, Thanks to the advent of technology, we can help you no matter where you live.
Hmm. And I like to ask this question to pretty much all my guests is what's one tip you'd give someone if they're maybe looking to get their body back to what it once was 10, 15 years ago? What one tip would you give for that person?
The first and foremost, is you need to take responsibility for yourself and realize that health is your responsibility. It's not the government, it's not the insurance company, it's not your neighbor, it's you. Just like if you own a house, you're responsible for the roof and the plumbing and the electrical. And if something were to go wrong, it's on you to get it corrected. With your health, if you have a problem, if you're not happy with where you're at right now, and you've already been to the medical doctors and you've already tried the medications and all that stuff, and you're still not where you want to be, you need to try something different. Just doing the same thing over and over again and expecting a different outcome is one person's definition of insanity. So when people come see me, typically they've already been to medical doctors, they've been to the PCP, they've been to a medical specialist, and they failed to fix their problem to that person's satisfaction. And at that point, it's really their thing to look for what else is available out there. I say, just like there's more than one way to cook an egg, there's always more than one way to fix a health problem, no matter what it is. Drugs are one option, but it's not the only option available to you.
Yeah, well said. Well, where's the best place for people to learn about your services, Kevin?
I would think that my website would be the best place to start. That is metabolicsolutions.net. And if
Excellent.
you go there, you can read a little bit about what I do, and there's ways to get in contact with me. One of the things that people like to do is to set up a free discovery call, just to tell me their story and tell me what's going on and if I can help them or not. And it's a free phone call. It's about a 10 to 15-minute conversation where you just talk to me about what's going on in your life and what have you done to fix this problem so far and what your goals are. And then I can give you some advice or point you in the right direction.
Excellent. Well, Kevin, this was great, short but sweet, and I'll be sure to put a link in the show notes so people can learn about you and your services and set up that call with you. So I appreciate you coming on and sharing the knowledge today.
Thank you very much for having me. It was a pleasure.
Thanks for listening to the show. I know there's thousands of podcasts out there, and you chose to listen to mine. I will put a link in the show notes if you want to connect with my guest. And if you are looking for one-on-one consulting with me, I will put a free 15-minute link so you can set up a call to see if you're fit for my 6-month health breakthrough program. So thanks again. Feel free to rate and subscribe. I would love that to help support the podcast. And till next time, have a great rest of the day, and I will see you on my next podcast. Thanks so much.